and ranking member of the Budget Committee. Congressman, thanks for being here.
It's great to be with you, Brett.
You have the floor, sir.
Well, thank you, and it's great to be here with you to discuss the future of Medicare, which I think, as we know, provides health and income security to millions of American seniors. And the Medicare debate, of course, is taking part in the context of a larger debate over the budget, about our priorities and values. So I want to make it clear at the beginning that we believe we have to reduce the deficit in a steady and predictable way. The question is, how do we do it? And to govern is to choose. And we think the choices made in the Republican budget on Medicare and other points are wrong for America, and we think we have a better alternative. So I want to talk to you about both those things. First, with respect to the choices in the Republican budget. They choose to end the Medicare guarantee, but they don't get rid of the big subsidies for oil companies and other corporations that exploit loopholes in our tax code, and many of whom pay absolutely no income tax. And with respect to Medicare, they do two things. One, they immediately increase the exposure of seniors to rising prescription drug costs. Why? Because they eliminate our effort to close the prescription drug donut hole. That happens right away. Second, they end the Medicare guarantee, and they force seniors into the private insurance market, where seniors will face rapidly rising health care costs with a lot less support from the government. It's a great deal for the insurance industry. It'll be a bonanza for them, but it's a lousy deal for America's seniors. And here's why. The costs in the private insurance market on a per capita basis have been rising faster than the costs in Medicare. That's according to the most recent Medicare Trustees report, and it's confirmed by the CMS, Centers for Medicaid and Medicare Services. And what this chart shows is that in the private insurance market, the per capita costs each year between 2002 and 2009 have been going up at 6.7%, whereas in Medicare it's 4.6%. And we all know that. People have been in the private market buying private health insurance because between the year 2000 and 2010 we saw premiums more than double as insurance company profits for the top five more than quadrupled. And that is a very bad place to be putting seniors, especially when at the same time you're going to give them a relatively declining value. Whether you call it voucher, premium support, I don't care. The reality is it doesn't begin to keep pace with the rising costs. And that's what the nonpartisan CBO indicated. And what they showed in the year 2020, under the Republican budget, because of the higher costs in the private market and less support from Medicare, seniors will pay an additional $6,350. And it gets worse and worse as time goes on because the costs keep going up and the relative support from Medicare through the voucher premium support goes down. So here's what happens in the year 2030. And in that year, again, according to the nonpartisan Congressional Budget Office, seniors will pay over $11,000 more. Now keep in mind that right now, the median income for a Medicare beneficiary is under $21,000. So you're asking them to either eat these higher costs or they're going to have to take a much lower benefit package without the health protections. This, at the same time that the budget said we're going to cut the top income tax rate for millionaires by 30%. So that's why Newt Gingrich got it right the first time when he said this was a radical plan and right-wing social engineering, and that's why there's a better way forward. Which is to continue to implement the reforms we began in the Affordable Care Act, and I'd be happy to discuss those with you. I can continue the presentation now.
Well, sure, go ahead, because that's the question that most Republicans have when they hear all of the presentations and the attacks on the Republican plan, is what specifically is the Democratic plan to deal with something that even a Democrat economist, Alice Rivlin, says is unsustainable.
Well, there's no doubt we have a challenge in Medicare going forward, and that's why in the Affordable Care Act, the Reform Act that we passed last year, we began to put in place mechanisms to, first of all, reduce the cost of health care throughout the system, because Medicare is a player in that larger system. We want to reduce the costs. We also made some reforms in Medicare. For example, we ended the overpayments to the private plans, the Medicare Advantage plans. There are private plans in Medicare. About 25% of Medicare beneficiaries choose them, but they have actually not been more cost-effective. We had to eliminate the subsidy. There are additional things we need to do. For example, when the prescription drug bill was passed, there's no reason they wrote right into law that the government could not negotiate drug prices like the Veterans Administration did. A lot of lobbyists pushed in the pharmaceutical industry pushed for that, but there's no reason. Let me just say this. This is a statement from the Medicare Trustees Report, the most recent. Very clear. The financial outlook for the Medicare program is substantially improved as a result of the changes in the Affordable Care Act. And if you look at this chart prepared by the trustees, they show that as a result of the Affordable Care Act and the changes, if implemented fully, will significantly bend the cost curve. So that act
So stay with what you have.
Sure.
Is what it is.
No, not
or
not
adjust it.
No, what you have in the Affordable Care Act
Sure.
is a series of steps that will be taken over a period of time that are just beginning. We're reading in the papers now about accountable care organizations. The idea is to modernize the Medicare system, to incentivize quality of care over quantity of care, to make sure you get value, not volume, and drive down the costs. On top of that, as I indicated, there are things you can do to strengthen the Medicare program's bargaining position with the pharmaceutical industry. Before 2005, for people on Medicaid, we paid lower drug prices. When they became what we call dual eligible Medicaid and Medicare, we ended up paying more. There's no reason to do that. That saves right there tens of billions of dollars. Better coordination of care. So there are lots of things that are going to be done as part of the implementation of the Affordable Care Act, but also additional things that we can do to bring down costs.
Congressman, stay around if you would for the head-to-head debate.
Very
Appreciate
good.
it. Thank you.
Thank you.
We will find out what White House Budget Director Jack Lew thinks of the possibility